Spot these 8 prostate cancer symptoms. Early, don't risk your health before it is too late. Every year, thousands of men unknowingly live with a potentially deadly threat lurking within their bodies: prostate cancer. Often referred to as a silent killer, this disease can develop and progress for years without showing any clear or alarming symptoms. By the time it becomes apparent, it may have already advanced to a stage that is far more difficult to treat effectively. However, there is a silver lining. Early detection dramatically increases the chances of survival and successful treatment. The power to protect your health is in your hands. Did you know that approximately 1 in 8 men will be diagnosed with prostate cancer during their lifetime? That's a staggering statistic that underscores just how common this disease truly is. In the United States alone, it's estimated that more than 288,000 new cases will be diagnosed this year, and tragically, nearly 34,700 men will lose their lives to this illness. Despite these daunting numbers, prostate cancer, when caught in its early stages, has a survival rate of nearly 98%. This makes awareness and early action absolutely essential. Recognizing the early warning signs of prostate cancer could save your life or the life of someone you love. Subtle changes in the body can sometimes be the only indication that something is wrong. It's important not to dismiss these signs as just part of aging. Understanding what to look out for empowers you to take charge of your health and seek medical guidance before it's too late. In this extended guide, we'll highlight 8 early symptoms of prostate cancer that no man should ignore. Understanding prostate cancer. Before diving into the warning signs, it's vital to understand what prostate cancer is and why paying attention to prostate health matters. The prostate is a small, walnut-sized gland found in men, located just below the bladder and in front of the rectum. This gland plays a crucial role in the male reproductive system, primarily by producing the fluid that nourishes and transports sperm. The most prevalent type of prostate cancer is adenocarcinoma, which begins in the glandular cells of the prostate. Not all prostate cancers behave the same way. Some are slow-growing and may remain asymptomatic for years, lulling men into a false sense of security. Others are aggressive and spread quickly to nearby organs and tissues, creating life-threatening complications. This variability is why understanding symptoms and acting promptly is so important. 1. Frequent urination and nocturia. One of the earliest and most common signs of prostate cancer is a noticeable change in your urinary habits. If you suddenly find yourself needing to urinate more often, especially during the night, it could be a subtle but critical indicator. Known as nocturia, this condition involves waking up multiple times throughout the night to urinate. While it may seem like just an inconvenience, frequent urination, both day and night, can significantly impact your sleep quality, energy levels, and overall well-being. Why does this occur? The prostate gland is located just beneath the bladder and surrounds part of the urethra, the tube that carries urine out of the body. When the prostate begins to enlarge, which can happen due to both cancerous and non-cancerous conditions, it puts pressure on the urethra. This pressure can restrict urine flow, making the bladder feel full even when it isn't. The result is more frequent trips to the bathroom, a sense of urgency, and difficulty starting or stopping urination. You might also notice a weaker urine stream or the feeling that you haven't fully emptied your bladder, which adds to the cycle of constant urination. These issues can gradually worsen over time and may be misattributed to aging or less serious health conditions like an overactive bladder or benign prostatic hyperplasia, BPH. While those conditions are common and non-cancerous, the similarity in symptoms makes it vital to consult a healthcare professional for accurate diagnosis. What's particularly important is not to normalize these changes. If you've started to adjust your lifestyle around your urinary habits, like planning fewer outings or avoiding beverages in the evening, it's time to consider whether there's an underlying medical issue. Prostate cancer detected early has a very high survival rate, and changes in urination are often among the first clues that something may be wrong. Don't ignore persistent urinary symptoms, especially if they are accompanied by other warning signs like pelvic discomfort or blood in urine. A simple screening or conversation with your doctor could provide clarity and peace of mind, or potentially save your life. Stay vigilant, stay informed, and advocate for your health. 2. Painful ejaculation. Although it may be a difficult topic for some men to discuss, pain during ejaculation is another potential warning sign. Discomfort during ejaculation can occur in various areas, including the penis, testicles, lower abdomen, or rectum. While occasional mild discomfort might not be cause for alarm, ongoing or worsening pain could suggest a problem with the prostate. The prostate plays a key role in producing seminal fluid. Inflammation or cancerous changes in the gland can interfere with this process, leading to pain during ejaculation. Though painful ejaculation can also result from other conditions like prostatitis or BPH, it should always be evaluated by a doctor, especially if accompanied by other symptoms such as urinary difficulties or pelvic discomfort. 3. Blood in urine or semen. Seeing blood in your urine, hematuria, or semen, hematospermia, can be deeply unsettling, and rightly so. Even if the blood is only visible under a microscope, it signals that something abnormal is occurring. In many cases of prostate cancer, this symptom results from tumor growth or the disruption of delicate blood vessels in or around the prostate gland. When a tumor develops, it may interfere with or damage the vasculature of the urinary and reproductive systems. This disruption can cause blood to mix with urine or semen, creating a visible or microscopic discoloration. You might notice pink, red, or brown streaks, or a subtle change in color that seems unusual. Sometimes, the blood is so minimal that it only appears under laboratory testing, which is why regular screenings are also vital. While prostate cancer is a serious potential cause of this symptom, it's important to understand that other medical issues can lead to blood in urine or semen as well. These include urinary tract infections, kidney stones, trauma, inflammation of the prostate, prostatitis, or benign prostatic hyperplasia. However, regardless of the cause, the presence of blood should never be taken lightly. Delaying medical attention can increase the risk of complications. In the case of cancer, the sooner a diagnosis is made, the better the prognosis and the more treatment options are available. Even if the cause turns out to be less severe, identifying and addressing the issue promptly ensures your peace of mind and protects your long-term health. If you notice any discoloration in your urine or semen, or if routine testing reveals microscopic blood, schedule a medical evaluation without delay. Your body is giving you a signal. It's up to you to listen and act decisively. 4. Pain while sitting. Pain or discomfort when sitting down might seem like a minor inconvenience, but it can actually be a crucial early warning sign of prostate cancer. This type of pain is often centered in the pelvic region and can vary in intensity from a dull, persistent ache to sharp stabbing sensations. For many men, the discomfort may be most noticeable when pressure is applied to the area, such as when sitting on a hard surface or remaining seated for extended periods of time. Why does this happen? The prostate is located just in front of the rectum and below the bladder, a location that makes it particularly sensitive to changes when the gland is inflamed or enlarged. If a tumor is developing, it may begin pressing on surrounding tissues and nerves, causing pain and discomfort. In more advanced stages, the cancer can spread to nearby structures, including bones in the pelvis and spine, amplifying the sensation of pain and potentially making everyday tasks like driving or sitting at a desk increasingly difficult. Additionally, this pain may radiate outward, affecting the lower back, hips, thighs, or even the legs. This referred pain can make it difficult to identify the prostate as the root cause, leading many men to seek treatment for unrelated conditions such as musculoskeletal pain or sciatica. Because the discomfort is often chronic and does not resolve with typical treatments, it's vital to consider the prostate as a potential source, especially when accompanied by other symptoms like urinary changes, painful ejaculation, or blood in urine. It's important to distinguish this type of discomfort from more benign issues. Conditions like prostatitis, inflammation of the prostate not related to cancer, and benign prostatic hyperplasia, non-cancerous enlargement of the prostate, can also cause similar sensations. However, any persistent or escalating pain in the pelvic area should always be evaluated by a medical professional to rule out serious conditions, including cancer. Ignoring this symptom can lead to delays in diagnosis and reduce the effectiveness of potential treatment options. A proactive approach, seeking medical advice, undergoing necessary imaging or blood tests, and having honest discussions with your doctor, can help ensure that the underlying issue is identified and addressed quickly. Your comfort, mobility, and peace of mind are worth protecting. Don't dismiss persistent pelvic pain, especially if it disrupts your daily routine or quality of life. Paying attention to your body and acting early could make all the difference. Prostate cancer is a serious condition, but early detection gives you a powerful advantage. Listen to your body, take note of changes, and don't be afraid to have open, honest conversations with your healthcare provider. Your health and well-being are worth the vigilance. 5. Persistent pain in the back, hips, or chest. Ongoing or worsening pain in the back, hips, or chest shouldn't be brushed off as merely the result of aging or physical exertion. While it's true that many people experience discomfort in these areas due to common musculoskeletal issues, chronic or unrelenting pain can also be a serious red flag. One particularly concerning cause is metastatic prostate cancer. In advanced stages, prostate cancer can spread beyond the prostate gland and often targets the bones as one of its primary sites. This process, known as bone metastasis, may lead to persistent and often severe pain that feels deep-seated and localized, commonly in the lower back, pelvic region, hips, or even extending into the chest. Unlike typical aches that improve with rest, stretching, or over-the-counter medication, this type of cancer-related pain usually does not respond to standard remedies and tends to get progressively worse over time. It may interfere with sleep, limit mobility, and significantly affect quality of life. The presence of such bone pain should never be ignored, especially in older men or those with a family history of prostate cancer. Bone pain is considered a strong indicator that prostate cancer may have advanced and possibly spread to other parts of the body. This type of progression makes the disease more difficult to manage, so prompt recognition and medical evaluation are critical. If you or a loved one are experiencing persistent pain in the back, hips, or chest that cannot be explained by physical activity or injury, it's essential to consult a healthcare professional. Early diagnosis, even in more aggressive cases, can make a substantial difference in treatment options and long-term outcomes. Listening to your body and responding to unusual symptoms could be life-saving. Swelling in the legs or feet. Swelling in the legs or feet, also known as peripheral edema, may appear to be a minor or unrelated issue, especially when considering prostate health. However, when swelling is persistent, pronounced, or accompanied by discomfort and inflammation, it can point to something more serious beneath the surface. In the context of prostate cancer, swelling in the lower limbs may be a sign that the cancer has spread and is interfering with the body's normal fluid drainage system. The human body relies on lymph nodes and lymphatic vessels to manage and drain excess fluid from tissues. If prostate cancer metastasizes to nearby lymph nodes, particularly those in the pelvic or abdominal region, it can block the flow of lymphatic fluid. This obstruction leads to fluid buildup in the lower extremities, resulting in noticeable and often uncomfortable swelling in the ankles, legs, and feet. This kind of swelling differs from what might result from long periods of standing, sitting, or minor injuries. Cancer-related edema typically doesn't improve with simple remedies like elevation or compression and may worsen over time. Additionally, you might notice changes in skin texture, such as a stretched or shiny appearance, as well as sensations of tightness, heaviness, or aching in the affected area. While edema can also be associated with conditions like heart disease, kidney dysfunction, or blood clots, when it appears alongside other warning signs, such as difficulty urinating, fatigue, or bone pain, it raises the urgency for a comprehensive medical checkup. Swelling in the legs or feet may seem like an isolated symptom, but in the broader picture of prostate cancer symptoms, it can be a vital clue. Recognizing and acting on this symptom promptly can lead to earlier diagnosis and more effective treatment, improving overall prognosis and quality of life. 7. Unintentional weight loss. If you've noticed that you're losing weight without trying, without changing your diet, increasing your physical activity, or making other lifestyle adjustments, it may be tempting to shrug it off as a positive surprise. But sudden, unintentional weight loss can be a warning sign of an underlying health issue, and in some cases it may point to prostate cancer. Weight loss becomes especially concerning when it occurs rapidly and is accompanied by a lack of energy, ongoing fatigue, or other symptoms. In the context of prostate cancer, this often happens because cancerous cells demand an abnormal amount of energy to sustain their growth. As a result, they hijack your body's normal metabolism, diverting nutrients away from healthy cells. This metabolic disruption means that even if you're eating regularly, your body isn't retaining or using nutrients properly. The result? You begin to lose weight despite no effort on your part. Unlike intentional weight loss through diet and exercise, which usually comes with increased vitality, cancer-related weight loss often leaves you feeling drained, weak, and less capable of completing daily tasks. It's a form of weight loss that your body hasn't signed up for, and that imbalance should raise concern. Even more troubling is when this symptom appears alongside other early indicators of prostate cancer, such as pelvic discomfort, frequent urination, blood in the urine or semen, or lower back pain. When clustered together, these signs demand medical evaluation. Don't dismiss unexplained weight loss as harmless, or assume it's a result of stress or age. Your body could be sending you a crucial signal that shouldn't be ignored. Timely detection and diagnosis make a major difference in managing prostate cancer and preserving your quality of life. 8. Numbness and weakness in the limbs. Numbness, tingling, or weakness in your arms or legs may seem like a minor inconvenience at first. Maybe something you associate with poor posture or a pinched nerve. However, in more serious cases, these symptoms can indicate advanced prostate cancer that has spread to the spine. Prostate cancer, when it metastasizes, often travels to the bones, and the spine is a common target. If the cancer grows large enough to compress the spinal cord, it can interfere with the body's central communication network, the nerves. These nerves control movement and sensation in your limbs. When they're compressed or damaged, you may experience a pins and needles feeling, a loss of coordination, muscle weakness, or even total numbness in the arms or legs. Spinal cord compression is a medical emergency. Left untreated, it can progress rapidly and cause irreversible damage. Motor function can be significantly impaired, making it difficult to walk, lift objects, or perform daily activities. In severe cases, it can also disrupt bladder and bowel control, pointing to urgent spinal involvement that needs immediate medical intervention. These neurological symptoms are not only distressing, they're a signal that the cancer may have reached a more aggressive stage. Quick recognition and immediate treatment are critical. If you're noticing unusual sensations or weakness in your limbs, don't ignore it or delay speaking with a healthcare professional. Early intervention can prevent lasting damage and may also reveal underlying conditions like prostate cancer before they worsen. Risk factors for prostate cancer. Understanding the risk factors associated with prostate cancer is an essential step in protecting your health. One of the most significant risk factors is age. Your likelihood of developing prostate cancer increases sharply after the age of 50, and most diagnoses occur in men over 65. This makes regular checkups and screenings increasingly important as you grow older. Family history is another major risk factor. If your father, brother, or close relatives have had prostate cancer, or even breast cancer, your chances of developing the disease are considerably higher. Genetic mutations, such as BRCA1 and BRCA2, also play a role and should not be overlooked. Ethnicity can influence your risk, too. Research shows that African American men are more likely to develop prostate cancer than men of other racial groups, and they are often diagnosed with more aggressive forms. These disparities are influenced by a combination of genetic, social, and healthcare access factors. Your lifestyle also has a powerful impact. Obesity is linked to more aggressive and recurrent forms of prostate cancer. Diets rich in red meat, processed foods, and high-fat dairy combined with low physical activity can increase your risk. On the flip side, healthy choices like eating fruits, vegetables, whole grains, and lean proteins can offer protective benefits. Regular physical activity, even something as simple as walking, can help regulate hormones and strengthen your immune response. While you can't change your age or family history, you can take control of your lifestyle and prioritize regular screenings. Staying informed and proactive is your best defense. Prevention strategies. Taking steps to reduce your risk of prostate cancer is not just wise, it's empowering. Although no method can guarantee complete prevention, certain lifestyle changes can dramatically lower your chances and improve your overall well-being. Start with your diet. Emphasize whole, nutrient-dense foods, leafy greens, colorful vegetables, fruits, whole grains, nuts, and lean proteins. Specific foods like tomatoes, rich in lycopene, broccoli, and other cruciferous vegetables have been linked to prostate health due to their antioxidant and anti-inflammatory properties. Reduce your intake of red meat, sugary snacks, and processed foods to decrease inflammation and promote cellular health. Next, incorporate regular physical activity. Aim for at least 30 minutes of moderate exercise 3 to 5 times a week. Whether it's brisk walking, swimming, cycling, or strength training, staying active helps control weight, balance hormones, and boost your immune system. All factors that play a role in cancer prevention. Weight management is crucial, especially since obesity is tied to more aggressive forms of prostate cancer. Combine healthy eating with regular activity to maintain a stable, healthy weight. If you have a family history of prostate or breast cancer, speak with your doctor about personalized screening plans. The PSA, prostate-specific antigen test, may be appropriate for early detection. Discussing your risks and options with a healthcare provider ensures you're making informed decisions based on your individual health profile. Prevention is about long-term, proactive habits, not quick fixes. By committing to a healthy lifestyle and staying vigilant, you take control of your health and reduce your chances of facing more serious problems later on. Final thoughts. Recognizing the early signs of prostate cancer, like changes in urination, pain, swelling, numbness, or unexpected weight loss, can truly be life-saving. Early detection dramatically improves treatment success and long-term outcomes. Don't ignore what your body is telling you. If you experience any unusual symptoms, consult your doctor right away. Your health is your greatest asset. Prioritizing regular checkups, living a healthy lifestyle, and staying informed are the best tools you have in protecting it. And remember, you're not alone. Share this information with friends and loved ones, and encourage others to take their health seriously too. If this message resonates with you, give it a like, share it with others who might benefit, and subscribe for more health-focused insights. Let's work together to spread awareness and empower more people to take control of their well-being. Stay proactive, stay healthy, and we'll see you in the next video.